call on Senator Paul Gavan the need for the Minister for Health to legislate to create safe access zones for hospitals. 4 minutes, Senator.
Minister, it's good to see you. Thanks for coming in. Minister, you'll be aware we're coming up on the 3rd anniversary of the historic vote to repeal the 8th Amendment to the Constitution. I was proud to campaign alongside my party for repeal, and indeed, unfortunately, I was old enough to remember the first referendum in 1983, and I campaigned against that referendum. After the referendum, you'll be aware that then Minister Simon Harris promised legislation to establish safe access zones outside of hospitals. You'll also be aware of the commitment given in the programme for government to establish exclusion zones around medical facilities. However, 3 years on from that original promise, there's still no sign of this legislation. So, Minister, I want to ask you this morning about the status and plans for advancing the Safe Access Zones bill. You'll be aware, Minister, that every week there are gatherings outside of maternity hospitals by anti-choice protesters. The last government promised safe access zone legislation to ensure these protests do not take place outside of these hospitals. There are people monitoring, marching and praying and watching women going in and out of maternity hospitals. Every single day over Lent, there were protesters outside of the maternity hospital in my home city of Limerick. Minister, I hope you'll agree with me that women have fundamental rights to privacy and dignity, and especially so when they are visiting a hospital. I want you to think about the impact of these protesters on women as they access healthcare across this state. I'd ask you to listen to the following quotes from women who have encountered these protesters outside of a hospital setting, and I'm grateful to my colleagues in Together for Safety for supplying these quotes. The first one is, "She asked me if I had an appointment across the road. I presumed she was making small talk, as she also had one, so I said yes, I did. She told me she and her friends were praying that no babies were murdered in the hospital that day." Second quote, "They were sprinkling holy water and saying prayers outside a hospital setting, while there's women having miscarriages or having stillbirths each week, or carrying their babies out in white coffins." And a third, "We were attending the hospital because our baby had decreased fetal movements in the 3rd trimester. Thankfully, everything was fine, but the experience was pretty terrifying nonetheless. We were a same-sex couple, and this made me feel even more self-conscious. My wife was heavily pregnant and in pain. I was holding her hand as we approached the hospital, and the all-male group of protesters were really intimidating." Minister, these protests, which are happening across many hospitals throughout the state, are attempting to intimidate and cause upset. They are invading women's and pregnant people's privacy and bodily autonomy at a profoundly vulnerable and sensitive time. Minister, people should not have to access healthcare like this. So, Minister, legislation is promised. Can you give me a timeline as to when it will be delivered? I appreciate that the working out of this legislation is complex. There are competing constitutional rights, but your department has had 3 years to do that work, so you should be ready to produce this legislation by now. There are a number of examples of best practice legislation, a number of states in Australia, a number of provinces in Canada. So there's no end of good examples, and indeed an excellent research paper has been produced on this topic. One last point I want to make, Minister. In a previous answer to my colleague David Cullinan last year, your senior minister assured him that women and healthcare staff should be assured there is existing legislation in place to protect them and protect patients. This statement was not correct. The protesters I'm referring to are in violation of lockdown rules, but according to Gardaí, not of public order rules. So, Minister, we need to see this legislation and get it passed, and I look forward to a positive response.
Thank you, Senator. Minister, you have 4 minutes.
Thank you, Senator. And I'd like to assure you that the House, that ensuring access to termination of pregnancy services remain an ongoing priority for the Minister and for the Department of Health. And Senator, you outlined the proposal to draft the legislation to provide for safe access to termination of pregnancy services. It did arise from concerns about demonstrations against abortion which took place during and after the campaign for the referendum on the 8th Amendment of the Constitution in 2018, and at that time it was feared that protests against abortion, targeting service providers and inhibiting access would occur once services began to operate. For this reason, it was suggested that safe access to services would be provided for in the Health Regulation of Terminacy of Pregnancy Act 2018. Since services commenced in January 2019, however, there has been a limited number of reports of protests or other actions relating to termination of pregnancy. This is an extremely positive development, suggesting the termination of pregnancy services have bedded in relatively smoothly to date and are becoming a normal part of the Irish healthcare system in line with government policy. It is likely that the settings in which services are being offered in general practice and in hospitals has contributed to ensuring safe access to services, as attending general services means patient privacy is protected. In cases where protests have taken place outside healthcare services, I want to assure the Senator that there is existing public order legislation in place to protect people accessing service providers and local residents. Ireland has a considerable body of relevant public order legislation in force. This includes, for example, Criminal Justice Public Order Act 1994, the Criminal Justice Act 2006 and the Non-Fatal Offences Against the Person Act 1997. These statutes balance Ireland's constitutional and European obligations to protect people's rights to freedom of peaceful assembly, freedom of expression and freedom to express their convictions and opinions, with the prevention of disorder or crime, the protection of health and the protection of the rights and freedoms of others. The Department of Health has provided information on existing public order legislation to the HSE, and the Department has also liaised with An Garda Síochána around safe access to termination of pregnancy services, and the Garda National Protective Services Bureau issued a notice to all Garda stations raising awareness about this issue. The notice directed that any protest be monitored and breaches of existing law dealt with. The Department of Health has informed the HSE that An Garda Síochána advised that the service providers should contact their local superintendent to initiate a local solution tailored to the circumstances and needs of each individual case. This will also establish contacts for the service provider to call upon should the need arise. An Garda Síochána also advised that any protests or actions giving rise to a concern should be brought to its notice. The most important thing, Cathaoirleach, is that women accessing this service can do so with certainty of the quality and safety of the care they will receive. In that regard, the Department of Health continues to work with the HSE to ensure that all women in Ireland can access the service quickly and easily without bias or judgment, and that we continue to provide a compassionate and dignified termination of pregnancy service.
Mr. Senator, you have 1 minute.
Let's go here. Look, I am really concerned, Minister, by your response, because it seems that you are walking away from your own commitment in the programme for government to introduce safe access zone legislation. And I believe this would be truly disturbing to an awful lot of people in this country today, given the struggles that have been maintained for years to overturn that appalling constitutional act, and given the fact, and you don't seem to be aware of it, Minister, that there are ongoing protests outside of maternity hospitals. And what you've effectively given me in your answer today is to say, well, actually, we don't think there's a problem here. Now, you gave a firm commitment in the programme for government that you would legislate in relation to this issue. In your answer to me just now, you've given no commitment whatsoever. You've basically said things are fine and the existing legislation is there if needs be. The existing legislation, Minister, is not working, is not applicable. Are you walking away from this commitment, Minister? If so, I have to tell you, it's a disgrace and it will not be forgiven.
Thank you, Senator. Minister, you have 1 minute.
Thank you, Clerk. And implementing the Health Regulation of Terminacy of Pregnancy Act 2018 and ensuring safe access to services under the Act remains a priority for the Department of Health. And it is important that we remain aware that the majority of people in this country voted in 2018 to change our laws to allow greater access to termination of pregnancy services for those who need them. All indications, and I take what the Senator has said, that these services are both operating and available. They are being delivered in hospitals and in community settings. Overall, the HSE has advised that feedback from a wide variety of stakeholders, including the ICGP, is that the service has bedded down well. However, the Minister has asked me to assure the Senator that the Department of Health is continuing to closely monitor service provision. And there is also regular ongoing engagement between the Department of Health and the HSE to facilitate the smooth running of termination of pregnancy services and to resolve any issues that may arise.